is a void within the community to offer the services we offer, or to offer the services we offer in the way we do. So possibly it is the factor that distinguishes us from other service providers in the community. We have the language skills to communicate with the group. We have the understanding of the cultural background of all those seniors coming from different countries.
Donc, c'est important pour nous d'offrir à ces gens quelque chose que peut-être les Canadiens de souche ont la difficulté à offrir à ces gens. Parce que si on ne connaît pas une culture, c'est difficile de servir cette culture-là.
I can identify maybe 3 key elements I think that make the program successful. It's hard work, but at first I think it's having passion for what you believe in. I think the passion is the fuel that drives it. Second is to get a good team of people around you who equally believe in the passion. And the third is to create good partnership. So it's creating that kind of partnership, it's documenting your work, it is showing accountability and transparency in terms of how the money is being used, and keeping good record, financial record. It's all of those things combined that I think is necessary, and it takes time to build that. But once you start to build it slowly and you have the evidence, you find that more opportunities and more doors open, and more organizations want to know about you and want to talk to you, want to create partnership.
Because you have to have a group that is working together for the same deal, for the same program, for the same idea. To get good volunteers, and in our case you need a leader that will start all this. Because if you have a good leader that has a vision, your whole group is going to follow.
We're trying to help them to get active more. Like for example, Chinese people are very energetic. They have a better health, condition. But according to the research, many of them, after they settle in a new country or a new place, the health condition started to deteriorate after maybe 1 or 2 years, because due to the isolation. So mentally, stage affect the physical stage. So we're trying to help them to maintain their mental wellness by get them more active in their community first. So for example, when they come out, they to attend the program that we provide, they have a chance to get to know the others who had the same situation like them. So they become a friend within their community. And then after that, then together they go out to further place and to attend other programs.
Il est important de rentrer les activités du mieux-être qui reflètent la culture des groupes participants. C'est vraiment très important parce que on ne peut pas non plus négliger totalement sa culture. On vient avec certaines richesses et on vient avec un certain vécu, donc si on met ces activités dans notre programme, c'est pour essayer d'adoucir l'intégration de nos bénéficiaires dans la société d'accueil.
They have small groups, they find group of affinity, which is really good, has been very useful, because for instance, when one of them is sick, they already have 4 or 5 friends. It's like a small network who is taking care of themselves. That has been the case in many instances when they ended up in the hospital. They have already their small network, thanks to Club Casa de los Abuelos, that keeps them going.
On ne peut pas faire des ateliers de mieux-être comme organisme ethnoculturel sans participation de la famille. Cela est vraiment impossible. La famille est très importante dans tout le mouvement, dans toutes les activités de bien-être qu'on organise. Il est rare chez nous de voir quelqu'un se présenter sans son épouse ou bien son époux ou bien ses enfants. C'est toujours avec la famille et on a des activités de mieux-être spécifiquement pour les familles.
It was very important. Yeah, for us, right from the beginning, it was very important to connect with the parents. So the first session with the girls was also a first session with the parents. Like, even if the parents were not going to participate in the parents group, we asked them to go the first time. We wanted them to see us, to see even the place where the girls were going to be, to see the whole program. And we explained, I as a coordinator, I had support with the girls during the first session, so that I could then jump to the parents' room and talk to them, and explain the program. And right away I told them, you know what? I'm gonna talk to your girls about healthy sexuality. This is what I'm gonna tell them. Are you guys okay with that? Do you have any questions, any suggestions, any worries? We just talk right away, all that.
Alors c'était beaucoup mieux de prévenir au lieu de guérir. Et à ce moment-là, on commence à mettre de l'emphase sur des ateliers sur la santé pour des femmes, comme parler de l'obésité, de l'hypertension, du diabète. Et nous sommes des femmes, on est intergénérationnel, il faut le dire, mais la plupart de nos ateliers sont basés sur les personnes plus de 50 ans et plus, parce que elles ont besoin beaucoup de formation ou d'information pour pouvoir prendre soin ou changer leur mode de vie, les habitudes de vie. Les éléments non négociables, c'est très important, c'est la langue. Et quelque chose à manger. Alors, on peut ne pas s'organiser, on peut peut-être être à l'envers, mais la langue, une fois on parle leur langue, c'est correct. Et
If the seniors they have organized themselves in a way that they teach lessons, different lessons, let's say in Reiki, they have also computer classes, and they have attended last year, for instance, yoga exercises, and one senior has a big group of about 15 seniors, doing chair and cardio exercises.
First of all, I think is the information. By giving them information about the social issues in general, then we equip them with knowledge, so they can deal with the situation. They can equip themselves better because in new society, in new environment, that you need to be open-minded. You need to learn a lot of things in order to make your resettlement process as easy as possible, right? So information and knowledge of how to adjust that process is very important.
Un exemple, nous avons eu du financement de la ville d'Ottawa. Ce financement avait pour but d'inciter ou bien de sensibiliser nos bénéficiaires à utiliser les complexes sportifs de la ville, de toute la ville. Ce programme a été un succès total. Nous avons soutenu environ 100 personnes et puis sur ces 100 personnes, beaucoup continuent à utiliser les complexes sportifs. C'était un programme super.
That activities they are keeping helping. They are getting out of their homes or their apartments where they are very isolated. So they have also sewing classes. They have craft classes. But in addition to that, the traditional classes, the sewing, the knitting, the painting, the crochet, there are other parts that contributes to the well-being of the individuals. That is kind of mentally and physically. For example, in the case of mental, in addition to when they are active, your brain is busy and you are healthy. But also we have important talks with professionals. We hosted one on depression on seniors. It's a very important topic. Sometimes we don't know how depression is defined and how it is disguised as well. And it's difficult to recognize that. Sometimes we know that they are very isolated, and to approach them and talk about this is not that easy task. So we have to let it to the professional, at least to touch the door and talk and say. So.
We are helping the city, and we are helping even the health service provider groups in the city to keep this group of people and their caregivers healthy and stable with the programming that we offer. We don't spend more than $2 per senior per year in the activities that we provide free of charge to them. So I think that somebody should take a closer look at what we do